let's welcome.
Good afternoon po sa ating lahat, sa ating mga tagapakinig. Magandang hapon po at magandang umaga sa Canada. Canada ba? Ipagpapatuloy po natin yung ating topic, Foundation of Yin and Yang. Ang ating pong topic ay InterTransformation. InterTransformation. Example number 1, high fever. InterTransformation from Yang to Yin. High fever at the beginning. So makita po natin yung yang, tumaas. Initially, the yin contradicts. Hahabol po yung yin, babalance niya. After 2 or 3 days of fever, yin is consumed. The patient become more dry, thinner, and weaker. This causes a vicious circle. Ipo daw. Kadugsong po niya. Where the yang increases and the yin decreases gradually. So, nako-consume na po niya yung yin pag tumatagal na. So, extreme point of yang until yang reaches a point of its extreme. Then yang intertransform into yin. Ko-consume na niya yung yin. Situation after transformation, the yin and yang are both deficient, but yin is higher than yang. The yang has transformed into yin, thus increasing the yin. So, yun po yung intertransformation from yang to yin. Example number 2, yung mga manic depression. Intertransformation from yin to yang. Yin to yang naman po ito. So, pag example ito ay yung liver. So, patient cannot show anger, has a liver qi yang deficiency. Hindi pa masyado yan nagagalit kasi mas mataas pa yung yin. When angry, the patient suppresses and internalizes anger, depression, passive rigid. So, yung attitude po niya ay depressed kasi ang mas mataas ay ang yin. This starts off a vicious cycle where the depression gets worse and worse. Habang tumatagal sa kanyang galit, pababa ng pababa po yung kanyang yang. Until the extreme point of yin is reached, the yin will intertransform into yang, bringing on the manic phase. So pag manic phase na po, siya yan yung mga sumasabog na, bigla na lang sumisigaw, wala ng control sa sarili. At dahil yang na po yung mas mataas, from yin, transform into yang. Mga matagal na panahon. All the yin has been used and transformed to yang until both become deficient and there is relative peace. Sobrang, pag kung matagal na yung nararamdaman, yung sakit, lampas na sa level, so bababa na po siyang maigi. After an interval, the liver yin start rising again and the second cycle of depression begins. So, pagkatapos po nun, yung pathogenic factor tataas uli. Yung mga, pag tumaas po uli yung yin, magsisimula uli yung cycle. Po. So, yun po yung intertransformation nakita natin.
Okay, anyone who would like to comment? So, Ma'am Mildred gave 2 examples po ng intertransformation. Isa po ito sa relationships po ng yin and yang. So, dito, yung 2 examples, yung yang naging yin, yung yin naging yang. No? So, it's inevitable na pag naubos na po yung isa, magta-take over na po yung kabila. Okay? So, kailan kaya natin pwedeng agapan yung pasyente dito, Ma'am Mildred?
Habang nasa normal balance pa po. Kasi pag ganyan na pong deficient ng maigi, mahirap, matagal po yan gamutin, lalo pa pag hindi rin nagbabago ng attitude yung tao. Habang nasa balance pa, pag unang nakita natin, yun talagang sikapin nating magamot na. Kasi kung papatagalin ng papatagalin, pag nakita na natin sa dila, talagang kailangan i-advise na natin yung patient. Kasi
Mm.
pag yung tumagal ng tumagal at naglampas na dun sa balance, konting-konti na yung yin and yang, nag-intertransformation na, mas matagal po yung gamutin.
Katulad nito, yung high fever, no? Kaya time is of the essence po dito. Kasi baka isipin, ay nawala yung fever. Yung pala, naubos na yung, naging yin na siya. No? Naubos na yung yin. Bumabalik na naman. No? So pag mataas, automatically, humahabol, nag-o-oppose po si yin. So pag patuloy yon, dito pa lang sana may ginagawa na tayo, no? Yung ano pa lang superficial. Pero pag may fever na kasi pumasok na yan eh. So after 2 to 3 days, nauubos na po yung yin. Pag sinabi natin naubos yung yin, nawawala ng appetite, pumapayat na yung pasyente, no? So yun. So pag naubos po yung yin, tumataas din yung yang. No? So ito na po yung hanggang sa maabot niyo yung extreme point of yang. And then, mag-i-intertransform na naman pag naabot na yung extreme ng yang, ng yin. No? So, kailangan talaga natin malaman yung history. Di ba?
Opo, Dok. Para magandang example din dyan, Dok, yung may malaria na pag napapabayaan, di ba? Una nag-chills and fever, then puro fever. After ng puro fever na niya, chills na lang. Parang yun na yung last na drawing natin. Chills na lang, tapos nangihina na yan. Mahina na talagang basta't natagalan na po.
At saka fever lang tinitreat eh. Di ba? Bumabalik ulit.
Dapat may dinidispel tayo at may tinotonify.
Katulad nito, manic depression, no? Dapat po kasi pala, ine-express natin yung galit. Siyempre, hindi ka magbabasag ng plato. May mga technique sa clinic para mawala yung stress mo. Hindi ka naman pwede magsisigaw, no? So, pag galit ka, sinusuppress mo yon. And this is where mag-uumpisa na po yung vicious cycle. Of course, pag sinupress mo, mas nidi-depress ka. Hanggang sa umabot yung pinaka-extreme na yin. Pag naabot na yung extreme na yin, magiging yang na naman siya. No?
Opo. Kaya minsan, Doc, di ba, maganda yung halimbawa pag may pasyente tayong galit na galit, minsan kung gusto niyang umiyak, mas magandang umiyak siya.
Oo, ilabas.
Para ma-release niya yung galit niya.
Yes. Pero hindi ganyan yung treatment ng iba eh, no? So, yun. Saka always realize na hindi pa naman yung pasyente. Hindi pa naman for referral. We can still always do anything. Any questions? Okay, maraming salamat po for listening. I hope you got the message here. So, Ma'am Mildred was simply showing one of the relationships of yin and yang, InterTransformation. She will continue tomorrow. Maraming salamat po, Ma'am Mildred.
Thank you din po.
Next, we will have tongue diagnosis. Ipipresent po ni Ma'am Teresita. And welcome to Rizal, Ma'am Teresita.
Welcome, ma'am. Bago na ang kanyang
You are now an immigrant. Okay. Let's now welcome Ma'am Teresita Sumile from Rizal. Saan nga sa Rizal?
Sa Kainta po.
Kainta. Okay. Okay po.
Maganda pa ang signal doon, no?
Yes. And she sounds very happy now. O, diba? No more baka.
Nakatagpo na po siya doon.
Yeah. Sige. Okay. Okay, Ma'am Teresita, please go ahead.
Okay. Good afternoon, everyone, especially to Dr. Hector. Welcome po sa tongue diagnosis. Case 2 na po tayo sa still in constipation. This 40-year-old patient worked as a manager of a big factory. The job required her to travel a great deal. She worked hard and ate irregularly. Over the course of a year, she complained of constipation, which was aggravated by the constant travel and demands of her job. She had only one bowel movement every 3 days, and while the stools were usually well formed, she occasionally excreted small, hard pellets. In addition to a feeling that she had never quite emptied her bowels, she suffered constantly from foul smell and flatulence. Her abdomen was bloated and distended. She was tired, suffered, suffered from mood swings, and felt unhappy and stressed. The tongue body was long, pointed, and slightly pale. The tongue coating appeared moist and slippery. A thickish yellow coating showed at the root of the tongue. Her pulse was frail and wiry. Analysis. The patient's hectic lifestyle, emotional situation, and constant traveling caused liver qi constraint. This led to a blockage of qi in the lower abdomen, constipation, pellet-like stools, a distended abdomen, and a feeling of insufficient evacuation are all acknowledged symptoms. The wiry pulse, which also indicated liver qi constraint, confirmed the findings. Liver qi constraint leads to stagnation of qi in the middle burner and impairs the transportive and transformative functions of the spleen, interfering with the upward and downward movement of downward directed actions of the stomach. The ensuing buildup of dampness is reflected in the slippery tongue coating. The abdominal bloating and flatulence is a result of the disrupted flow of qi, a consequence of obstruction by dampness and food stagnation. The root of the tongue shows a yellow coating, which suggests the presence of damp heat in the lower burner. The tongue of this patient was noticeably long and pointed, indicating a constitutional weakness of the heart. Her constitution and hectic lifestyle are incompatible, and over a period of time led inevitably to development of heat in the heart. Okay, treatment. The treatment was directed at spreading liver qi, regulating the spleen, lubricating the intestines, and calming the spirit. The patient was treated with a modified version of rigid extremities powder. The following herbs were added to the basic formula. Pasensya na po ha. Redix, Aucklandae, Lapay, Rhizoma cyperi rotondi, Semen persicae, and Semen butae orientalis. After taking the decoction for 1 week, the patient's flatulence and bloated abdomen had disappeared. After a month, despite the traveling, her constipation disappeared, and she felt more relaxed. The tongue had resumed to its normal shape. 6 months later, the patient was still free of symptoms. She had resigned from her job and was looking for a less stressful occupation. Okay? Now we have a comparison of a tongue picture before and after treatment. Okay? As we can see in the tongue picture before treatment, the tongue body color is slightly pale, right? The tongue body shape is long and pointed. The tongue coating at the root of the tongue and is thick and yellow with moist and slippery. And the tip of the tongue is red, right? Okay. Constitutional weakness of the heart manifests not only a long midline crack, but also long and pointed tongue body shape, as we can see in the tongue picture of this patient. Now, since the patient has constitutional weakness of the heart, heat easily develops in her heart because of stress due to her hectic lifestyle. tongue indicates the presence of damp heat in the lower burner, causing the patient suffer from bloating, flatulence, and constipation, resulting from the patient's hectic lifestyle, emotional situation, and constant traveling, which cause liver qi constraint, leading to blockage of qi in the lower abdomen, which for a long period of time develops into damp heat. Okay? Now, after taking a decoction of herbs, the patient's flatulence, bloated abdomen, and constipation had disappeared, and after tongue bud and her tongue body shape returns to normal. The thick yellow coating and the dark spots at the root also disappeared, as we can see in the tongue picture at the right. So there is a big improvement, right? Yan lang po. Thanks so much for listening.
Thank you very much, Ma'am Teresita. Any questions? So that was a very beautiful example of constipation, no? Wherein you have to consider everything, hindi lang yung... So there are always reasons bakit siya naging constipated. So a thorough history is very important. Okay, if there are no questions, we will now proceed to diagnosis by interrogation. And let us now call straight from Baguio, Ma'am Vina Pascua. Good afternoon, Ma'am Vina.
Good afternoon po, Doctor. Good afternoon po sa lahat. At ang topic natin ngayon, tapos na po tayo yung eyes naman po ngayon, day 1. Eye pain. Ang ating pong mga mata are the orifice of the liver. Pero hindi po ibig sabihin nito na all eye problems are related to the liver. In fact, meron pong organs affect the eyes, and notable among these are yung heart, kidneys, and gallbladder. The heart influences the eyes as both its main and connecting channels go to the eyeballs. Sa reason na ito, maraming eye problems are due to heart heat deriving from emotional problems. Ang kidneys po nourish and moisten the eyes in a manner similar to the liver. At saka yung eye problems po in the elderly are very frequently due to kidney deficiency. The gallbladder naman channel also goes through the eyes, and ito po yung isang sanhi ng eye problem, usually in conjunction with liver fire or liver yang rising. And then again, why we asked, the question regarding the eyes are somewhat more important than those regarding the ears. So mas importante daw to. First, because eye problems are more common, and second, because some eye symptoms often clinch a diagnosis. For example po nito, the symptom of a dry eyes often clinches the diagnosis of liver yin deficiency, although it may be caused by kidney yin deficiency also. The next eye, when we asked. So sabi po ng author dito, I asked about eye symptoms early during pag nagtatanong na daw siya, in conjunction with questions aimed at identifying a particular pattern. Halimbawa po, pag yung patient ay nagpapakita ng symptoms ng liver blood deficiency, ang tinatanong daw niya po ay, meron ba siyang blurred vision and floaters? At, and then, tatanungin niya tungkol sa dry eyes to find out kung may liver blood deficiency ay nag-progress na po to deeper level of liver yin deficiency. So questions regarding blurred vision, floaters, dry eyes, and red painful, yung makating mata, are important, and sabi po niya, I asked them in a nearly lahat po ng case. How we asked. Blurred vision is not an expression most patients are familiar with. So, ang tanong po niya, kung yung kanilang vision ay sometimes not clear or somewhat obfuscated. Ito yung parang ang meaning nito is unclear, obscure, or confused. Stressing that the condition of issue is quite apart from their being short-sighted o kaya hindi. Floaters is another expression most patients are not familiar with. And ang tanong po niya, pag whether nakikakita ba sila ng black or white spots floating in the field of vision. The next po ay eye pain. Ito ay full or empty character of eye pain. So dito sa chart na ito, nakikita natin, sa table na ito, nakikita natin yung full and empty character of eye pain. So pag ang character ay onset at sudden, full o kaya yang. Pag gradual naman, empty yin. Yung oras naman, pag day, so full o kaya yang yan. Pag night naman, alam na po natin na yin or kaya empty. Time of the day, pag morning, full or yang. And then pag afternoon, empty yin. Constancy. So ito yung chronic and persistent pag full or yang. Pag empty yin naman, chronic, on and off full. Then another is swelling. So pag may swelling, full o kaya yang. And then pag without swelling naman, empty o kaya yin. Yung intensity, severe ba or unbearable? Ito ay full or yang, full or yang. And then empty or yin naman pag dull at saka mild lang. Ang inflammation, inflame, red and hot. Then empty o kaya yin, not red, not hot. Pag pressure, worse with pressure. So full or yang yan. Pag okay naman with pressure, better with pressure, empty yin. Dito naman, itong temperature, pag full o kaya yang, worse with heat, better with cold. Pag empty o yin, worse with cold, better with heat. So another is irritability. Pag full or yang, merong pain with irritability. So alam na po natin na liver yan, pag irritable. Pag empty yin naman, pain, empty o yin, pain without irritability. So yang deficiency. Then character of pain. Pag full o kaya yang, pain like needles. Pero pag empty o kaya yin, mild pain lang. Sa pagkain naman, pag full or yang, worse after eating. Pag empty yin, better after eating, worse when hungry, mabisin. Ay, gutom. Two excretions, itong urination and defecation. Pag full o kaya yang, redness, excretion, affected. Pag empty o kaya yin, no redness, excretion not affected. Then last po ay yung eyeball movement. Pag full o kaya yang, nagmumove po yung eyeballs. Pag empty o kaya yin, eyeballs not moving. So, sana naintindihan po natin. Thank you, Doctor. Thank you sa lahat.
Thank you very much, Ma'am Vina. Questions? Okay, we proceed to Paul's
Hello everyone. Pwede po bang magtanong, Doc?
sige po, please.
How about pagka yung eyeball is duling po? Pwede po ba siyang maging normal pagka halimbawa ginawa ng acupuncture?
Yung duling kasi, no, mas maganda po yan inaayos yung habang bata pa. Sa totoo lang, pag yung duling, ibig sabihin one of the muscles sa tinatawag nating extraocular muscles, no? Ito yung mga muscles na that can make us look up, down, to the left, to the right. So one of those muscles, medyo mahina. So actually, yung pinaka-ano talaga na gamutan dyan is surgery. However, nadadala din po yan sa practice. Ako kasi before ako nag-medicine, I was an optometrist, no? Ang tawag dyan, meron po tayong ginagamit na lens dyan para i-practice yung mata. So with acupuncture, I still believe na we need to consider integrating yung acupuncture with yung mga modalities ngayon, no? Yun. So isa sa mga magandang developments is scalp acupuncture. So if you would like to read about it more, meron po tayo sa Tristan Calas YouTube channel. You can watch all the videos there. I think there are like 12 videos, if I'm not mistaken. Dadagdagan ko pa po yun. Kasi yun po ang pinaka-most watched na na series ko sa playlist, no? So, again, depende po sa age, and it is something na hindi po yung biglaan na maayos, no?
At proseso din po.
Opo, wala pong magic, walang magic. And I know how to do that. Yung we use prism lens, prisms, no? So, practice yan. In fact, meron po kaming hopefully magta-tie up with us. It's a vision care group. Ginagawa pa yung building. So, very exciting po. So, yun. You might want to consider doing it. And again, you have to always consider yung ibang mga modalities para mas makatulong. No?
Okay po. Salamat, Doc.
Salamat din po.
Ay, Rayan pala po. Taga Jensan po ako, pero andito po ako sa Saudi.
Ay, kayo po si Ma'am Rian?
Okay po.
Ikaw pala yung nanonood sa Saudi. Kaya pala, sabi ko, ay biglang, sa ngayon kasi I have 21 countries already, no, including Philippines. Ay, may pumasok
Yes
sa
po.
Saudi. Ikaw pala yun. Okay.
Opo. Kasi,
Hindi lang kayo iisa. Meron ng nakaano. Sino po yung if you don't mind, sino po yung may konting, may strabismo.
ano po kasi yung
strabismo.
kasama ko dati sa boarding house, nasa Pinas pa ako. Pero hindi na siya duling ngayon, Doc.
Di ba?
Naayos yung mata niya.
Kung pupunta ka ng isang magaling na optometrist or ophthalmologist, madali po ayusin yan. I'm not so sure about Acu, no? Ito kasi something na ano lang naman yan. It takes several sessions.
Hello, Doc. Pag i-relate natin, Doc, sa TCM, yung duling, kasi syempre yung ice liver and yung muscle na may na spleen, ibig sabihin kung inborn ito, possible na yun ang weak.
Opo. Spleen, kasi muscles
Spleen and liver po possible na yun ang weak.
Of course. Liver, spleen, kidney, lahat na.
Thank you po, Doc.
Okay, thank you po. Welcome po sa ating I hope nag-enroll na kayo sa ating CAA program. Maraming
Yes po, nag-enroll po ako, Doc. Kaso, ay tanong ko nga po kay Doc Abet about sa practicum kasi pauwi ako ng July.
Ay, opo, inano ko na. Ay, sinet ko na. Most likely June. Ay, gusto mo July? O di i-move na lang natin ng July.
Kasi pagka halimbawa bilhan ako ng ticket, tapos para alam ko kung ilang days ako sa Manila. May practicum at saka parang OGT din sa clinic, Doc.
Mga ilan po kayong buwan ay, di ba sa kayo, Jensen?
Opo.
Okay, sige po. Tingnan natin. Let us know kailan po kayo babalik para pwede natin itapat yung practicum sa module 1.
Kaya nga po, halimbawa, bilhan ako ng ticket, tapos yung malaman ko lang po kung ilang days ako pwede mag-stay sa Manila bago ako umuwi ng Mindanao.
Okay po. So usually mga ilang araw ba kayo nasa Manila?
Kaya nga po depende po kung ilang araw po yung practicum at saka yung clinic na ano, yung parang OJT.
Requirements. Paki-coordinate
Opo.
na lang kay Sir Albert. Ma'am ha, malayo-layo pa naman.
Oh, sige po, thank you
Let
po.
us know kung kailan po niyo nabili yung ticket. Maraming salamat, Ma'am Rian. Thank you.
Sige ba? Sige po, Doc. Salamat.
Any other questions?
Okay na po ako doon.
Okay po. Maraming salamat.
Thank you po, Doc.
Okay, next we go to pulse diagnosis. Punta na po tayo sa pulse diagnosis. Let's call on Ma'am Mildred once again. Intermittent pulse. Nako, ito.
Gandang hapon pong muli. Pulse diagnosis, intermittent pulse. Intermittent pulse. Pulse description. The intermittent pulse stop at regular intervals. So, stop siya pero regular. It may be slow, rapid, or of normal rate. After stopping, it gives the impression of taking a long time to start again. Nakatakot naman itong pulse na to. In order to establish whether a pulse is intermittent or not. It is important to count the beats for a long time because it may stop only once in every 50 beats. Clinical significance. The intermittent pulse always indicates a heart disharmony, but also the severe depletion of other yin organs. The simple question in chapter 17 says the intermittent pulse indicates depletion of qi. The intermittent pulse is seen most frequently in several deficiency of heart qi, so related sa heart of intermittent at spleen. So the shorter the interval at which it is stopped, the more yin organs are diseased. So yung pala, pag mas shorter yung intervals niya, yin organs ang may problema. According to chapter 5 of the spiritual axis, if the pulse halts every 50 beats, one yin organ is diseased. If it halts every 40 beats, two yin organs are diseased. If it halts every 30 beats, 3 yin organs are diseased. Matatandaan po natin, every 10 ano. If it is halts every 20 beats, 4 yin organs are diseased. Habang pabagal ng pabagal, mas parami yung organ na may problema, may sakit. And if it halts every 10 beats, all the yin organs are diseased. Ayun, pag 10 beats na lang yung intermittent niya, lahat ng yin organ. If the pulse is stopped regularly after less than 4 beats, it indicates a serious condition. The intermittent pulse may also indicate shock. Strangely, all Chinese books say that an intermittent pulse around 100 days of pregnancy is normal. So pag buntis, normal. Common conditions that present with an intermittent pulse include heart disease, chest painful obstruction syndrome, and some menstrual disorder. Intermittent pulse summary of clinical significance. So ito, pag intermittent pulse ang inyong pulso, meron kang heart disharmony, possible na shock, problem in yin organs. So yun po yung pinapakita ng intermittent pulse. Combination. Intermittent slow indicates exhaustion of original qi. Intermittent rapid indicates internal heat or occurring against the background of heart disharmony. Heat kasi rapid. Intermittent overflowing indicates the location of disease in the connecting channels. Intermittent fine dip denotes severe spinchi deficiency or possible with chronic diarrhea. So pag dip, possible sa diarrhea. Intermittent fine minute indicate exhaustion of body fluids. Intermittent knotted indicate heart disease occurring against a background of heart-yang deficiency. So yun po yung mga combination. Differentiation of similar pulses. Knotted. The knotted pulse is slow and stop at irregular intervals. So yun po yung knotted ano. Whereas the intermittent pulse may be slow, rapid or of normal rate and stop at regular intervals. Hasty. The hasty pulse is rapid and stop at irregular intervals, whereas the intermittent pulse may be slow, rapid, or of normal rate and stop at regular intervals. So yun po yung pagkakaiba nila. Clinical significance in each position. It is not applicable because an abnormality in the speed or rate of the pulse will be the same in all positions. Thank you. Intermittent pulse.
Thank you, Ma'am Mildred. May questions po tayo. Okay, mukhang wala kasi napaka-complex.
Magandang tandaan yung doc, yung di ba yung
Yung ilang organs.
pag na lang, ilat na palang yung organ ang may problem.
Yes, exciting, di ba? Okay. Invite pala tayo ng mga tao sa April 10, 11, and 13. Electroacupuncture webinar. Kayo po ang sasagot ng mga questions. May pupuntahan daw si Dr. Webb. Anyway, so from pulse diagnosis, punta na po tayo ngayon sa differential diagnosis. Let's welcome Ma'am Neets. Good afternoon, Ma'am Neets.
Good afternoon, Doc Hector and everyone. How's my audio, Doc?
Very clear po.
Thank you. Okay. So, the topic for today in our 172 TCM Foundation is damp heat in large intestine. Okay? In traditional Chinese medicine, dampness and phlegm.
Ma'am, medyo mahina, ma'am. Lapit ka po.
Mahina ba? Lakasan ko? Sisigaw na ako.
Lapit
Okay
ka po
na
sa
yan?
iyong microphone.
Naka-headset kasi ako eh. Okay na, ma'am? In TCM,
Medyo lumakas na po.
nilalakasan ko na, sumisigaw na ako dito. In TCM, dampness and phlegm develop when digestion and fluid metabolism are sluggish. Okay. This can obstruct the movement of qi, eventually creating heat, which combines with the pre-existing dampness and phlegm. Okay. As we all know, large intestine's main function is to absorb fluids so as to form and excrete the stools. Okay? This can be greatly disturbed due to the dampness in the organ. As a result, fluids cannot be absorbed properly and diarrhea happens. Dampness can also be reflected by the mucus in the stools. Feeling of heaviness, kasi may dampness, heaviness, okay? Abdominal, fullness and pain, a sticky tongue coating, and slippery pulse. Finally, fever which doesn't disappear by sweating might also occur due to dampness. So, yon, kailangan maging aware tayo kapag may fever. Severe na yon kapag may fever. So, this can be caused by diet. It can directly affect the large intestine. Ang mga diet na sinasabi dito, yung excessive consumption of cold and raw food, which can cause interior cold like diarrhea or loose stools. Okay? Yun ding excessive greasy and hot foods can cause damp heat in large intestine. So, foul or urgent and loose stool with burning. Yung medyo masakit pagka nadudumi at saka yung bigla-biglaan. Okay? Emotions din, okay? Lung and large intestine belong to metal element affected by sadness and also by worry. Worry causes lung qi to become deficient and fail to descend, which can contribute to stagnation of qi in large intestine, the abdominal pain and constipation, yan. Also, stagnation of liver qi can affect the intestines in the same way. So, another cause, exogenous pathogens, yung lamig, it can directly invade the large intestine causing abdominal pain and diarrhea. Okay? Ang signs, abdominal pain, sa excess pattern, diarrhea, dampness impairs fluid absorption in the intestine, mucus and blood in the stool, damp which causes mucus, heat causes extravasation of blood, foul stool, burning anus, yung heat, scanty and dark urine, fever and sweating, thirst without a desire to drink. So, pagka may heat, it can cause the thirst. Dampness causes a lack of desire to drink. Merong heavy sensation sa katawan at sa mga limbs. Yung dampness, yung stuffiness in the chest and epigastrium. Okay? Ang tongue, red body with a sticky yellow coating. Ang pulse ay slippery and rapid. Etiology, too much hot and greasy foods plus emotional problems. Example, yung sinabi natin kanina, worry and anxiety over long period. It all cause interior heat. It may accompany other patterns involving interior heat such as liver cheese stagnation with liver fire. Okay? So, possible presenting condition yung dysentery, colitis, Crohn's disease. Okay? Sign and symptoms, sinabi na natin kanina, parang summary na lang to. Diarrhea with abdominal pain, incomplete defecation, mucus and blood in stools, stools with an offensive odor, burning sensation in the rectum, tenesmus, scanty dark urine, sweating, thirst but no desire to drink, heaviness in the limbs, bitter taste. Okay? Pulse is slippery and rapid. Tongue is red with a sticky yellow coating. Okay? Treatment principle, clears heat and disinhibit dampness, resolve toxins. Okay? Acupuncture treatment, we're going to use acupuncture points as spleen 9, which resolves the dampness in the lower burner. Bladder 22 resolves dampness in lower burner also. Stomach 27 promotes urination. Bladder 25 clears heat from intestine. Ren 12 resolves dampness. Okay? Stomach 44 harmonizes the intestines. Spleen 6 resolves dampness in lower burner. Stomach 25 stops diarrhea. Ren 6 or CV6 regulates Qi in the lower burner. Large intestine 11 clears heat, and stomach 37 clears and inhibits damp heat. Okay? Needle with drainage or reducing, add moxa. Okay? Thank you very much.
Thank you very much, Ma'am Needs. Any questions? No questions? Okay, so from differential diagnosis, we proceed to acupuncture patterns and practice. Nasa second part na po tayo ng summary for dementia, no? And towards the end, meron po tayong multiple choice questions. So what are the key points ng syndrome differentiation for dementia? Dementia pertains to a root deficiency, branch excess. So the commonly seen syndrome in the clinic is deficiency excess complex. So for dementia, due to deficiency syndrome, pasyente po will have lack of spirit, lusterless complexion, emaciation, reluctance to speak, weak ang mga galawan. So there are three patterns, including depletion of the sea of marrow, liver, blood, and kidney yin depletion, at saka spleen and kidney yang deficiency. For dementia, due to excess syndrome, presentation po ng patient, lack of mental ability, dull pa rin yung facial expression, slow mental and physical reaction, sudden changes of emotion, demonstrating the pathogenic factors katulad ng turbid phlegm, static blood, and wind fire, clouding the spirit and harassing the orifices. So treatment principles: treating such a complex and debilitating disease, mahaba po ang treatment, long course of treatment. Kailangan po natin in-nourish yung healthy Qi, Yin, Yang. Kailangan natin i-replenish yung essence. while simultaneously unblocking the channels, removing obstruction, expelling phlegm, and draining fire. Let's now go to the multiple choice questions. Who would like to answer? I'll read the question first. The basic pathogenesis of dementia is A, Qi deficiency and essence depletion with turbid phlegm clouding the orifices. B, depletion of the sea of marrow causing the dysfunction of mental activity. C, phlegm and blood obstructing collaterals with depletion of the sea of marrow. D, spleen and kidney deficiency with phlegm and blood obstructing collaterals. And letter E, dysfunction of mental activity due to turbid phlegm clouding the orifices. Who would like to answer po? Anyone?
Parang pwedeng A, Doc.
Try
Or D.
again. Ano po next answer nyo?
Letter B.
Pwede ring B.
Letter B po talaga ang best answer, di ba?
Letter B ang at kasi yung
Opo.
mental
Sea of
activity
marrow.
niya.
Opo. Depletion, naubos na yung sea of marrow. Yeah, very good. Almost, I think all of you got it right. Okay, meron po tayong tatlo. Pangalawa, all the patterns below are representative patterns of dementia, except A, depletion of the sea of marrow. B, spleen and kidney deficiency. Parang minention ko na ito lahat. Letter C, phlegm turbidity clouding orifices. Letter D, internal obstruction of static blood. Letter E, exterior cold and interior heat.
E.
Ay, wow. Correct answer is E. Yan po ang except. Wala pong kinalaman ng exterior cold. Very good. Let's go now.
Letter
Correct
E.
din si Ma'am Vina. I think all of you. Sino po ba nagsagot? Okay, very good. Now let's go to number 3, the last question. For dementia with clinical manifestations of apathetic facial expression, walang kalatoy-latoy, reluctance to speak, ayaw magsalita, loss of mental function, normal appetite, okay naman yung pagkain, drooling from the mouth. Yan pa lang ano na po yan, napaka-obvious na po yung drooling. Pero mas maganda, titingnan natin yung dila. Pale tongue with greasy coating, slippery paws. This syndrome is due to A, depletion of sea of marrow. Ano ba ito? Inulit lang. Letter B, spleen and kidney yang deficiency. C, phlegm and blood stasis obstruction. D, internal obstruction of static blood. Letter E, phlegm turbidity, clouding the orifices. Tingnan po yun yung tongue pag nandito kayo. Ma'am Mildred, are you going to have a tongue that is pale tapos may greasy coating pag spleen and kidney yang deficiency?
Yung slippery pulse po. Dampness.
No, but greasy coating, I don't think so. Any other tries?
Letter E.
Wow. Why po? That's the correct answer, letter E.
Kasi hindi naman, actually yung dementia for yung mga mahilig mag-isip, yung mga parang ganun.
Affected na yung yung orifices papunta sa brain. 'Di ba? Tingnan niyo po drooling from the mouth. Drooling, may lumalabas na mga
Yes po, tama.
Tapos yung tongue, pale, greasy coating, slippery pulse. Of the 5, the best answer is letter E. Okay, sana po walang dementia sa ating mga mahal sa buhay. So, kung meron po tayong mga pasyente na may ganon, you have to already inform the relatives na ang gamutan niya po is pangmatagalan. Okay, ayun.
Yung madalas siya na mag-iisip, no? Tapos magkaka-wrinkles ka din diyan pagka sobra mong pag-iisip.
Yes. Kaya, actually, pag isip ka ng isip, lumilipad yung chi mo. Oo. So,
minsan
tumatakbo yung no? Kaya wag na mag-isip. Life is short. Maraming
na
salamat po.
memory loss.
Maraming salamat. Okay, so I hope everybody is having a great time. We will now proceed to signs and symptoms. Okay, let's now call on Miss Kainta Rizal once again. Wala pa palang good evening. Good afternoon, Ma'am Teresita ulit. Please take over.
Good afternoon po, Dr. Hector and classmates. Signs and symptoms, we have itchy throat and dry throat. A, invasion of wind. Itchy throat with sudden onset, aversion of cold, stiff neck, fever, headache, floating pulse. Other symptoms and signs depend on whether it is wind cold or wind heat. Okay. Next is lung yin deficiency. Signs and symptoms po are chronic itchy throat, dry cough, weak voice, dry throat with desire to sip water, hoarse voice, night sweating, tiredness, tongue without coating in the front, and floating empty pulse. Letter C, lung dryness. Signs and symptoms are itchy throat, dry cough, dry skin, dry throat, dry mouth, fierce, hoarse voice, dry tongue, and fine pulse. Letter D, dryness invading the lungs. Signs and symptoms are itchy throat with sudden onset, dry cough, aversion to cold, fever, dry nose, dry and sore throat, tongue red in the front with dry, thin white coating and a floating pulse. Next is dry throat. Letter A, signs and symptoms of empty. We have here lung yin deficiency, chronic dry throat, hoarse voice, dry cough, weak voice, dry throat with desire to sip water, night sweating, tiredness, tongue without coating in the front, floating empty pulse. Acupuncture points used are lung 7 with kidney 6, lung 9, ren 12, and spleen 6. Next is kidney yin deficiency. Chronic dry throat at night with desire to drink in small sips, dizziness, tinnitus, hardness of hearing, poor memory, night sweating, vertigo, lower back ache in bones, nocturnal emissions, constipation, dark scanty urine, infertility, premature ejaculation, tiredness, lassitude, depression, slight anxiety, normal color tongue without coating, and floating empty pulse. Acupuncture points used are kidney 3, lung 7, with kidney 6, and ren 4. Next, we have other patterns, stomach yin deficiency. Signs and symptoms are chronic dryness of the throat, no appetite or slight hunger but no desire to eat, constipation, as in dry stools, dull or slightly burning epigastric pain, dry mouth, especially in the afternoon, thirst but either no desire to drink or a desire to drink in small sips, slight feeling of fullness after eating, normal color tongue without coating in the center, and floating empty parts. Next is liver yin deficiency. Signs and symptoms are chronic dryness of the throat, dizziness, numbness or tingling of the limbs, insomnia, blurred vision, flutters in eyes, dry eyes, diminished night vision, scanty menstruation or amenorrhea, dull pale complexion without luster but with red cheekbones, muscular weakness, cramps, withered and brittle nails, very dry skin and hair, night sweating, depression, the feeling of aimlessness, normal colored tongue without coating, and a fine or floating empty cuts. Next is invasion of wind heat. Signs and symptoms are dry throat with sudden onset, itchy throat, sore throat, aversion to cold, fever, cough, stuff or runny nose with yellow discharge, headache, body aches, slight sweating, slight thirst, swollen tonsils, tongue slightly red on the sides in the chest area or on front part, and floating rapid pulse. Next is heat in the stomach and spleen. Signs and symptoms are dry throat, swollen throat, burning epigastric pain, thirst, sour regurgitation, nausea, foul breath, a feeling of heat, excessive hunger, red tip of the nose, dry lips, mouth ulcers, dry stools, scanty dark urine, yellow complexion, red tongue with dry yellow coating and overflowing rapid pulse. Next is heat in the liver and gallbladder. Signs and symptoms are dry throat, bitter taste, thirst, blurred vision, hypochondriac pain, nausea, headache, red eyes, red tongue with redder sides, and dry yellow coating with wiry rapid pulse. Lesser Young pattern, 6 stages. Signs and symptoms are dry throat, bitter taste, hypochondriac fullness and pain, alternation of chills and feeling of heat with predominance of the former, irritability, unilateral white tongue coating, and wiry pulse. Next is gallbladder heat pattern, G level of 4 levels. Signs and symptoms are dryness of the throat, thirst, bitter taste, hypochondrial pain, alternation of chills and feeling of heat with predominance of the latter, irritability, unilateral yellow tongue coating, and wiry rapid pulse. Next is wind dryness heat invading the lungs. Dry throat with sudden onset, sore throat, itchy throat, aversion to cold, fever, dry cough, stuff or runny nose with yellow discharge, headache, body aches, slight sweating, slight thirst, swollen tonsils, dry nose, tongue slightly red on the sides in the chest area or on front part, and the pulse is rapid and floating. Yun po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. Any questions? Okay, we will now proceed to the last but not the least topic, straight from Katinan. Let's welcome Sir Aldrin Tukay. Good evening, Sir Aldrin.
Hello po, magandang gabi po sa lahat.
Magandang gabi. Long time.
Magandang gabi na po. So, na-miss ko yung class natin. Halos ngayon lang ulit ako nakabalik. Busy sa work. So anyway, share screen lang po ako. Okay, so yun, regarding sa asthma, ganyan, yun nga po, i-discuss natin ngayon yung early onset allergic asthma at saka yung Siaochuan. Okay? So dito maganda yung discussion ngayon kasi based dun sa author, wait lang po. Mute ko lang si classmates. Okay, nag-mute na po. Okay. So based sa author, ganyan. So may mga binabanggit siya na yon hindi related sa Shangchuan, ganoon. So based sa mga clinical studies niya or sa experience niya siguro, ganyan. Kaya yon actually nasa discussion kasi tayo nung ano yung angkop na etiology ng asthma sa western sa Chinese medicine, traditional Chinese medicine. So, yun nga ang sinasabi, itong siyang Xiao Chuan ay pupwede or malapit-lapit. Pero in some signs and symptoms niya kasi, so hindi siya masyadong related sa asthma. Okay? Some related, some hindi. Ganun po. So, let's proceed. Ano po yung connection at saka pagkakaiba ng early onset allergic asthma at saka ng Xiao Chuan? Let us start by analyzing the gaps. So take note, may gap na binabanggit. In the Chinese view of Xiang Chuan in relation to early onset allergic asthma, we will look at the three areas of etiology, pathology, at saka differentiation treatment. So meaning, para makita natin kung talagang match ba siya, ganoon. So ang sinilip ng author, etiology, pathology, at saka yung differentiation. So let's talk about the etiology. It will be remembered that the main etiological factors mentioned in the theory of wheezing, the Xiao, and the breathlessness, Chuan, are merong internal pathogenic factor, ay external pathogenic factor, diet, emotional problem, fatigue, chronic illness, and excessive sexual activity. Okay? Yun po yung sa etiology. Let us now examine each of these etiological factor in relation to allergic asthma and also any gaps in the traditional etiology of Xiang Chuan. Xiao Chuan. So, sa atopy, ganyan, a fundamental gap in the traditional theory of Xiao Chuan is that it has no concept of allergy and atopy as an etiological factor in asthma. Okay? So, although early onset asthma is so clearly related to the allergic immune hypersensitivity. So, ano ang ibig sabihin nito? Okay? So, pag kasi sinabi nating asthma, ganyan may concept ng allergy. Okay? Parang allergens, ganun po siya. Halimbawa, ang nagti-trigger sa asthma mo is pollen. Ganyan, pag nakalanghap ka ng pollen, uh, mati-trigger yung asthma mo, ganoon. O kaya ay balahibo ng aso o kaya pusa. 'Di ba may trigger, ibig sabihin kapag merong trigger yung allergens na yon nalanghap mo, ganyan, magkakaroon ka ng asthma o yung tinatawag natin na allergic allergic ka doon, okay? So a few modern Chinese books briefly refer to the allergic nature of asthma, but they still apply the theory of Xiao Chuan for its treatment. Okay, so para ang sinasabi lang dito, ganyan, although hindi masyadong related nga si Shan Chuan, ganyan, pag may asthma, yung treatment, ganun pa rin yung ginagamit. Ganon. So, maybe, Hindi natin alam, may mga case study naman siguro na it helps a lot naman sa mga patients. So next is the external pathogenic factors. Most books say that asthma attacks are elicited by invasion of external pathogenic factors such as wind cold or wind heat. Okay, so definitely totoo rin naman 'yan, 'di ba? Lalo't um, pag mahangin tapos sobrang mainit yung panahon, posibleng isang allergen din yung dust na pwedeng malanghap nung patient or nung may allergy sa dust, 'di ba? Tapos kapag mainit yung panahon, talagang nakaka-trigger 'yon. 'Yun yung mga trigger nila. Pwede rin wind cold, 'yun yung nagti-trigger ng kanilang asthma, okay? While wait lang, i-mute ko lang si classmates. So, yon the wind cold at saka, ay sorry, ba't nag-fast forward ko? Sorry po, nag-fast forward. So, wind cold at saka wind heat. While this is true in some cases, it is certainly not true in all. Okay? So, yon hindi lahat ng asthma ay due to wind cold or wind heat. Yun lang po yung gustong sabihin niyan. Hindi lahat. Okay? So, diet. Let's talk about diet. The theory of Xiang Chuan mentions that excessive consumption of maaasim, greasy, or malalamig na pagkain as an etiological factor. While this is certainly true in late onset asthma, it cannot be true when asthma starts in early childhood. Bakit? Kasi kapag early childhood, yung mga bata, ganyan, hindi naman sila masyadong nagko-consume ng mga maaasim, greasy at saka mga malalamig na pagkain. Ganon. So meaning, kahit bata pa lang may asthma sila, ganyan, or may asthma na yung bata, ganoon. Pero, hindi necessarily na ang pinagmulan nun is sa diet or excessive consumption ng mga nabanggit natin. Okay? Sour, greasy, at saka cold food. Actually, pag ganun mga bata nga, mas mahihilig sila sa matatamis, hindi sa maasim, di ba? Ganoon. Then, dairy food. Okay, so pag sinabi nating dairy food, more on, di ba, ang epekto niyan sa spleen, right? Okay? Pero ang sinasabi dito, yung dairy food, which certainly are a possible etiological factor in asthma, ganon. Kasi yun nga, sa Western, meron yung tinatawag na yung lactose intolerance, ganoon. Ganyan, kapag inom sila ng gatas, 'di ba? May allergy sila doon kaya 'yon nagti-trigger ng either 'yon mayroong asthma or diarrhea rin, ganoon. Pero sa China kasi ganoon, hindi sila kumakain ng dairy food, okay, or like milk or cheese, etc. Okay? So meaning, hindi isa to dun sa mga gaps na binabanggit. Then, next is yung overwork at saka excessive sexual activity. Overwork and excessive sexual activity are mentioned in the theory of Xiao Chuan, are clearly not an etiological factor in children with asthma. Bakit? Kasi kapag bata naman, di ba, hindi pa naman sila nagwo-work, 'di ba? Puro laro lang naman pa ang ginagawa niyan, okay? So meaning, hindi overwork yung pinagmulan nung kanilang asthma. Lalo't lalo na sexual activity. Grabe naman, bata pa lang tapos over over sexual activity na agad, 'di ba? So, definitely, sa mga bata, hindi yan po yung pinagmulan ng kanilang asthma, okay? So emotional stress. So emotional stress such as worry, brooding, and pensiveness mentioned in the theory of Xiao Chuan is certainly not an etiological factor in very young children with early onset asthma. Okay? Definitely, wala pa naman talagang masyadong stress sa mga bata, 'di ba? Hindi kagaya sa mga adult na yung level ng stress mataas. 'Di ba? Okay lang siguro sa mga bata yung stress nila kapag inaway sila ng kalaro, isusumbong lang nila sa parent o makikipag-away sila or iiyak nila. Bukas okay na 'yon, 'di ba? Magkaibigan ulit sila bukas. Yung level ng stress parang wala lang, 'di ba? Parang nangyari ngayon, bukas wala na. Hindi kagaya sa mga adult na na pag stress ka sa trabaho ay hindi lang sa araw na ito, parang dala-dala mo yung stress na yon, hindi lang linggo. Ganun po, di ba? Kaya sa mga bata, early onset asthma, hindi relate or hindi kasama itong emotional stress. So, I think last ito, weak body condition. One of the etiological factors of Shanchuan, which does not apply to early onset allergic asthma, is a weak body condition. In young children, this may be caused by a severe attack of measles, whooping cough, or pneumonia. So definitely kasi pag mga bata nga naman, di ba, masasabi natin na relatively mas malakas pa yung kanilang katawan, mas malakas pa yung kanilang immune system. Okay? So definitely meron man silang asthma, nagkaroon man sila ng asthma, hindi sa weak body condition. Liban na lang kung nagkaroon sila ng mga ibang diseases like itong measles, pneumonia, etc. Okay? So in summary, differences between early onset allergic asthma and Xiao Chuan etiology. So the theory of Chan Chuan has no concept of allergy and atopy as an etiological factor in asthma. Number two, most books say that asthma attacks are elicited by invasion of external pathogenic factors such as wind cold or wind heat. Diba? Pero sabi nga, hindi lahat wind cold or wind heat. While this is true in some cases, it is certainly not true in all. So the theory of Shanchuan mentions the excessive consumption of sour, greasy, or cold foods as an etiological factor. Pero this cannot be true when asthma starts in early childhood. Kasi yung mga bata nga naman, hindi masyadong nagpo-consume ng ganitong klase ng pagkain. 'Di ba? Kagaya ng nabanggit ko, mas gusto nila mga matatamis pa nga. Okay? Then dairy products, which certainly are a possible etiological factor in asthma, are not mentioned in the etiology of Shanchuan simply because they are not eaten in China. Intolerance to milk is an important etiological factor in allergic asthma. Okay? Then overwork and excessive sexual activity, as mentioned, sa theory ng Shanchuan, so hindi siya related din sa mga children with asthma kasi yun nga, hindi pa naman sila nag-overwork at saka sexual activity. Then ganun din sa emotional stress, okay? Sa mga bata, wala pang masyadong emotional stress, okay? Hindi kagaya ng mga adult. So, yun lang po yung topic natin tonight. Thank you po.
Thank you po, Sir Aldrin. May mga tanong po tayo bago tayo mag-break. Okay, if none, Sir Aldrin will continue with the topic tomorrow. See you po later at 8 o'clock for Dr. Gavina's lecture. Thank you everyone, especially the presenters. Good evening po. Join us again tomorrow. Thank you po, 5 o'clock.
Thank you po.
Thank you, Doc.